All right. Okay, now it's
Yeah.
done. Okay.
Okay,
Thank you
no
so much.
problem.
Yeah.
Okay. Wait, I'll put it back in. Okay, let me see if you're seeing the first slide right now.
Nope, can't see it. Can you try again, maybe? Yeah, I can see it now. Perfect.
Okay, and you're just seeing the slide, right? The presentation.
Yeah, I can see it.
Yeah, okay. So, and if I do this, can you see the whole presentation or?
Yeah, I can see the Google Docs.
Okay, and if I do this, you just see the slide, right?
Yeah, that's correct. Yeah.
Okay, so let me start out by once again thanking everyone for being here. Like you said before, I graduated from Palacky University in 2019. I then started working in Portugal in 2020, and so I started this whole process back then. I then interrupted it and I went back to Czech for a while. I started my medical residency there and I then decided to come back. So I'm once again in the beginning of this process. So in this slide, I just sort of laid out what's the traditional schedule of the whole application process. So the dates I wrote here, so this would be the process for someone who would be graduating this year. So you will see I put it all in just some simple steps and I will go over them one by one. But I will just emphasize that the most important thing here when it comes to getting a residency position in Portugal is your PNA or your national ranking exam score, because that's the only criteria which is done it's the only criteria which is used to select your specialty training. So if you go to if you see the beginning of 2022, so the first thing that a graduate should do is to register with OM. So OM stands for Ordem dos Médicos, which is the Portuguese Medical Council. So this would be the first thing that that an international graduate would do. You would register with the Medical Council. You would then start your application process. And I wrote down the dates. So you should register until November with the medical council, and then between August and September, sorry, you should register with the medical council until mid-September, because your application for a residency program should happen between March and not March, sorry, August and September, and your exam usually takes place in November. Then the following year, you should do your general training, and the results for your exam will come up, and matching usually happens around November of the following year, and you would start your residency in 2024. So as you can see, it takes quite a while, but it is an integrated process, which means that, I know that in the UK, people usually do foundation year, and our general training is the equivalent to foundation year. And in the Portuguese system, it is basically integrated in one single process. So once you apply, you will do your general training and your residency right after that. So I see that someone wrote down, yeah, if you have any questions, you can write it in the chat. I will try to keep an eye for any questions, or you can ask anything in the end. So I just wrote down some basic information for every one of the steps. So to register with the Portuguese Medical Council, there are basic things that you need. So you need your diploma, you need your legal situation sorted out. So you need either Portuguese ID, passport, or a visa permit. You need your criminal record. And if you are registered with a medical council in a different country, you also need a certificate of good standing. So basically, this is pretty much a universal document that your medical council will write you in case you are registered with a medical council and you want to register with a different medical council in a different country. And basically it means that you don't have any legal action against you, or that you don't have any malpractice cases, just basically saying that everything is okay. And then the last thing which you would need is your language exam, also called PROVA de Comunicação Médica. So this is the next slide, yeah. So this language exam is basically an online exam. The level is pretty much B2 from what they say. And it has two parts. It is the first part consists of listening and reading. Second part consists of writing and speaking. And for those of you who are applying for or who are thinking about working in the UK, so the structure of this exam is very similar to the structure of IELTS. But the exam consists mainly of medical cases or medical scenarios. So for the listening part, you will, for example, have a patient talking about symptoms and signs, and you will have an MCQ test where you will have to select the correct options according to what you hear. For reading, it will be something similar where you will have a text and you will have to select the most appropriate answer. But yes, unlike IELTS, this is exclusively medical cases or medical scenarios. And yeah, for practical terms, the exam takes place once a month, and it's a pass or fail exam. There is no grades. There are no grades. You just need to pass it in order to register for the register for the medical council. You will then apply for, after you register with the medical council, you can then apply for residency. So the documents are pretty much the same as you would need to register with the medical council. One thing that is important here is you will need to get your medical diploma recognized with the Ministry of Education, and you should also get your GPA recognized and converted into the Portuguese system. And the reason for this is because your GPA is only useful for one thing, and it's to pick the place where you're gonna do your foundation year, your general training. In case you do not have it converted, they will give you the minimum grade, and you will have a very limited amount of places where you will be able to pick from. But yeah, this is just a general note. And like I said before, when you apply for Internato Médico, so Internato Médico stands for medical residency. But like I said, medical residency here, it's an integrated program where you will have your foundation year done in the beginning, and then your specialized training or residency done right after. So I saw that someone has posted some questions. So criminal record from only Czech or our country too. So here, if you are a citizen of the UK, you should bring your UK criminal record, and you should also bring your Czech criminal record. And Daniela has asked if PNA can be done in English. No, it is only done in Portuguese. But I will talk a little bit more about PNA after. So yeah, going back to the slide, when you are applying, most people will apply for both of them because like I said, it is an integrated program. But in special cases, you can apply either just to general training or to specialized training. So you can apply to general training in case you don't want to do your residency, because there are other medical jobs that you can do without having your specialty training. So if you don't do your residency, you can work in the emergency room, you can do aesthetics, like aesthetical procedures like injections and Botox and this sort of stuff. If you do the appropriate training, you can work with occupational medicine in some cases. So some people will just do general training, and they will do this sort of work. Or for example, if people don't think that they have prepared enough for the exam, they might just sign up for general training and do the exam in a later year. Or the other option is to apply just for specialized training, and this will be the case if you have completed your general training before. So as I was mentioning before, you can do your general training and do some other sort of job, not residency related, and later on, when you decide, you can do the exam and apply for specialized training, so your residency. Yeah, so the general training, or Formação Geral in Portuguese, is the Portuguese equivalent to foundation year. So this lasts for 1 year from January till December. And during this year, you will do 4 rotations. You will do 1 rotation in primary care, which is what I'm doing right now, where you will do GP training and you will do public health. And this will last 3 months. You will then do a surgery rotation, internal medicine rotation, and a pediatrics rotation. So I cannot tell you how foundation year works exactly, but here, when you're doing your general training, you are practicing medicine supervised, which means that you will work in the outpatient department, you will work within the hospital with patients who are admitted, you will do emergency department, but you will always have either some resident or some senior doctor to consult with. So during your foundation year, you will always have, and usually during your residency training as well, but during your foundation year specifically, you will have a lot of supervision. So it is quite good, because I know when you finish medical school, sometimes you feel like you don't know anything, or you don't know enough. And here, during your foundation year, or at least from my experience, your seniors will be very helpful, and they will help you a lot, especially when you're doing emergency shifts and night shifts and all of this. It's very well organized here in Portugal. So during your foundation year, or during your general training, your results for your national ranking exam will come up, and later during that year, you will pick your your residency according to those results. And like I said before here, this is probably the most important thing. And if you want to work in Portugal and if you want to do your medical residency, this is probably the most important thing that you should know, that the residency matching is done exclusively based on your result of this exam. So your national ranking exam is a 150 question MCQ exam, which is very similar to USMLE. It's similar in terms of the types of questions that are asked, and it's similar in terms of topics of the exam. So in this exam, you will have questions from internal medicine, so from all areas of internal medicine, cardiology, pneumology, gastroenterology, hematology, etc. And also from pediatric surgery, gynae and obs, psychiatry. So you will have a total of 150 questions, and you will do the exam in 2 parts. Each part will be 75 questions in 2 hours, and you will have a break between the 2 parts. You do the exam in October, November, and the official results only come out in March of the following year, while you're doing your general training. And the matching will be done around October, November of the following year, based on the results. So usually until June or July, they will announce the total number of places. So in the last years, it's been between 1,600 to 1,900 places, and usually there are about 2,500 applicants, something like that. When the results are posted, they will post the ranking, and what happens is that they will let you know. For example, in the last week or in the last 2 weeks of November, they will say, so the first 100 people on the list will come on Monday morning, then the next 100 will come on Monday afternoon, then the following people will come on Tuesday, and etc. So the places will be picked, and you will be updated as they are being picked. And yeah, so it will be around 1,600 to 1,900. So every year there are usually people left out who don't have any place, and these people will have to retake the exam and wait a year, and 1 year, and we'll have to wait 1 year to retake the exam. So someone wrote in the questions, I read that it's 10% GPA and 90% PNA for residency. So I cannot tell you for sure. I can tell you how it works now. So right now it's 100% 100% PNA. I know that they are planning to change it, but for this year, it's still 100% PNA. I heard that for people who are currently in their 3rd or 4th year, that it should change by then, but I'm not 100% sure. If you want, I can check it out and I can let you know. But right now it's 100%, but you might be right that it might change in the following years. So yeah, like I said, every year there are people left out, and those people who are left out, they need to retake the exam because the exam is only valid for that year. One thing that you should keep in mind is that when the ranking is posted, there are people who are gonna withdraw when it comes to the matching process, because they will either not get a place in the specialty that they want, or they will not get a place in a specific hospital. So even if, let's say you are number 1950 on the list, and there are only 1900 places, it doesn't mean that you will not get a place, because if 50 people will withdraw, you will get a place. And this actually happened this year, that a lot of people withdrew from the process. So the last people on the list actually managed to get a place. Then my last slide, I just wanted to share with you some statistics from the exam, because as I said before, I think this is probably the most important thing from this whole presentation and from the whole procedure in Portugal, is the exam and it's the results. So I'm gonna try to change here. Yeah. Okay, so just let me know if you're watching the Google Doc with the Excel.
Yep, I can see it.
Yeah, so so this is what the ranking would look like. So here you can see the ranking and you could see the grades. So like I said before, it's 150 questions in this exam. And as you see here, the best grade, it was 136. So once they changed the exam to this new format, the best grade has never been more than 90%. And here I have some statistics. Here you will have, I'm sorry, this is in Portuguese, but I can translate, but I just wanted to show you guys. So here you have the list of all the residency programs, and here is the minimum grade. So it means like this was the lowest grade that someone had to be admitted in that program. So you will see here, and I think this happens pretty much everywhere, that the highest grades would be, for example, here in plastic surgery, dermatology, then gastroenterology, here also ophthalmology, ENT, and urology is also pretty high. And on the other hand, on the other side of the spectrum, you will see like anatomical pathology. You will see also GP, general practice. You will see also pathology. You will see internal medicine, and yeah. So and this table or this Excel is for last year, but if someone is interested, you can have this presentation, and they have on this in this Google Doc, they also have statistics for previous years. So you will see, for example, in 2020, it was pretty much the same. The grades were once again the highest for plastic surgery, dermatology, gastro, here, ophthalmology, ENT, and urology. So these are pretty much the top picks in Portugal. And if I think there's also a slide here that would show. No, so yeah, this is the last slide I wanted to show you. So it just shows which sort of grades you need to get in order to get a specific into a specific residency program. Where can we find this link, and who is writing these documents? Is it from a website? So this document is this document basically belongs to a group of people who have been following the application process throughout the years, and they have statistics basically since 2019. But here the most important thing is the last 3 years, because those are the years since the format of the exam has changed. So before that, people would get 100% in the exam, and a lot of people would get in the range of 90 to 100%. And right now, as I've shown you before, the best grade was 136 last year, and the year before that it was also 136. So these statistics are more accurate. Like I said, it's a group of people. I'm not sure if they are doctors, but they are doing the statistics every year. I can share this document with you. I think it should be fine, because anyways, if you have the link, you can only see it. You cannot edit anything, and that's another reason why it's very good. It's because only a select amount of people are responsible for the information here, and all the information here, all the results, everything is of public access. So it's also one of the reasons why it's accurate, is because people cannot lie about their results, because everything is of public access, so you can double check if everything is okay. But yeah, all the documents here are pretty much accurate, and they can help you guide your application, and they can help you pretty much know what score you need to aim for when you're studying, and during during your general training. Once you get your result, it can let you know if what you can predict your place in the ranking, and you can basically know if you need to retake the exam or not. And yeah, so this was pretty much what I had prepared for you guys. It was just an explanation of the overall application procedure, but if anyone has any questions, feel free to ask. I will go back to the presentation. Yeah, I will give you here, I will share it in the chat, the link for the statistics. Okay, if more than one person has the same grade, how does the selection process occur? So that's a good question. So I will go back to the list, and here they don't really explain, but if two people, so you can see here number 3 and 4 have the same grade, and here you see something that says padronização. So basically what this means is that in this case your GPA will be helpful. So your GPA here, it will only serve, or at this moment will only be used in case of a tie. So this number right here will be your GPA standardized to a certain number, and they will only be used in case of a tie. Wait. Is it okay for you to share your email for any questions later? Yeah, I wrote my email here in the last slide. So it's joaogomes10@gmail.com. And here's my WhatsApp. I will write it in the chat as well. So if you have any questions, it's here in the chat. And what's the work environment like? What kind of stuff, procedures do you get to do? Thank you. Like I said before, I also worked where I started my medical residency in the Czech Republic, and I saw a huge difference between the work environment in Portugal and in the Czech Republic. So and the main difference is that in Portugal, once you're doing your general training, you are the work environment is extremely good, except when you're doing emergency shifts. But even then, it's quite good. Because you have a lot of residents in the hospital, and the hospital is in lots of cases, it's run by interns. So you will have a lot of young doctors, and they will know what it's like to be in your position. So they will be very helpful towards you. And in case you have any questions, they will help you with everything, with writing reports, with bureaucratic stuff, with procedures as well. And when you were saying what sort of stuff or procedures do you get to do? So it depends on your rotations. I don't know if you're talking about residency or during your foundation year. During your residency, obviously you need to do, you need to learn how to do everything within the scope of what the specialist of that specific specialty needs to do. But as a doctor during your foundation year, it depends on the rotation you're doing. For example, if you're doing internal medicine, you will do admissions, you will do rounds, you will discharge patients, but discharging patients you can only discharge with supervision, obviously. But you will do morning rounds, so you will see your patients, do physical exam, you will do admissions and collect history, and you will see patients. So yeah, this is something that is quite different here in Portugal. We don't have A&E as a specialty or emergency medicine, which means that in Portugal, most patients that come to the emergency department, they're either seen by internal medicine doctors, or they're seen by non-specialist doctors. So during your foundation year, when you're doing your internal medicine rotation, you will do shifts in the emergency department every week, and this can be probably the most stressful part of your foundation year, but still you will get to learn a lot. And as I've said many times before, it's always supervised. So one thing that I really emphasize is like that you should really know once you get to this stage, is that you should obviously know how to do a physical exam, how to collect how to do physical exam, how to collect a medical history, because you will always discuss your cases with a senior doctor. So obviously no one is going to tell you anything. If you see a patient who is in extreme pain and you prescribe some painkillers, but you will not start antibiotic therapy to any patient by yourself. You will always be supervised. So yeah, this is mainly what the tasks of a doctor during your foundation year. And let me know if you have any additional questions. I also see here that someone asked, do you recommend any resources for the PNA exam? Yeah, so for your PNA exam, what most people are doing here in Portugal is that they're using question banks such as UWorld and UWorld. I think it's the main one that people are using, and what a lot of people do is that they sign up with some specific schools or academies which will prepare you for the exam. So they will do either online or presential lectures every week or every day. I don't know how it works exactly, because there are a few schools who do this. So they will do presentations, they will do lectures, and they will do simulations. So they will have, it depends on the school, but they can have, for example, once a month, you will do a simulation of the exam, and this will help you know what how your study is going, and or what areas do you need to work a bit harder on. So I think probably those are the main tools that people are using. So it's either question banks, or they're using they're signing up to these schools and doing lectures and again question banks and simulations. So does anyone else have any other questions?
Okay, I don't see any more questions in the chat box, so I think that's about it. And thank you so much for your time, and
Yeah, no
thank you
problem.
guys for attending. If you have any further questions, then of course you can get in touch with Dr. Gomes on his email or WhatsApp. And thank you again for your time.
Yeah, no problem. I didn't go into specifics in a lot of the bureaucratic stuff with the registration with the medical council or with the language exam. But if any of you guys is interested and has any questions, like I said, I left you my contact details. You can get in touch with me. I will help you, because this can be a bit complicated, but I think like if you have someone guiding you on, it should be fine. So yeah.
Okay, perfect. Thank you everyone for attending, and I hope everyone has a nice evening.
Yeah. Thank you, everyone. Have a nice evening and good luck with exams.
Bye bye.
Obrigada.